Good morning, my name is Ana Gavino, and I'm going to talk about HIV infection with AIDS and pneumocystis pneumonia. It is a serious infection that causes inflammation of fluid buildup in the lungs. It is caused by a fungus called Pneumocystis jirovecii. A healthy immune system can easily control it, but it causes a type of pneumonia in people with a weakened immune system, such as those with HIV. This is why it is called an opportunistic infection. We can see here on the video the symptoms of this infection. At first, PCP may cause no symptoms. Call your doctor right away if you have any of these signs or symptoms of PCP. It can be fatal. You can see fever, mild and dry cough or wheezing, shortness of breath, especially with activity, rapid breathing, fatigue, major weight loss, and chest pain when you breathe. Application in medicine. PCP is the most common opportunistic infection in HIV-positive people. Those with a CD4 cell count less than 200 are at highest risk. 30% to 40% of HIV-positive people develop PCP if they wait until their CD4 cell count drops to around 50 to receive treatment. PCP is still a major cause of death in AIDS patients in the United States. PCP is a very treatable and preventable infection. You can see another video about this infection. Pros of this infection, we can see that it has a treatment, but if you develop PCP, you are likely to take Bactrim, Sectra, or Cotrin. These drugs are a combination of two antibiotics, trimethoprim and sulfamethoxazole, or TMP SMX. Before HIV medication was available, PCP occurred in 70 to 80 of HIV-positive people. The number of cases has decreased a great deal. This is due to highly active antiretroviral therapy and PCP preventive drugs. Another video. You can see some disadvantages of this infection. There is not a vaccine available to prevent this type of pneumonia because it raises CD4 counts. Hard is the best way to prevent PCP. If you are a smoker, you can reduce your risk for PCP by quitting. Another video, you can see an example and anecdote of this infection. In Ecuador, you can see that there are a lot of people with HIV that can have this infection, this pneumonia. Another video. The conclusion is that PCP is the most common opportunistic infection in HIV-positive people. Those with a CD4 cell count less than 200 are at highest risk. 30% to 40% of HIV-positive people develop PCP if they wait until their CD4 cell count drops to around 50 to receive treatment. So if you wait too much time, you can die. So you have to pay attention if you present some of the symptoms that I already mentioned. So PCP is still a major cause of death in AIDS patients in the United States. PCP is very treatable and preventable infection.